Then send it with the requisition form to the laboratory. To obtain a sample for a wound culture, place the child in a comfortable position that allows easy access to the wound.
Let's put this pillow under your arm. Will you be comfortable like this for about 10 minutes or so?
Yeah.
Okay. I'm going to take the old dressing off.
Then remove the soiled dressing and discard it in the waterproof bag.
A little bit, but mostly it itches.
That's good. It means it's healing, so don't scratch it, though, or you can make it worse. I'm going to put this pad under your arm. That'll help keep the pillow and your sheets clean while we...
Put a waterproof underpad beneath the area with the wound. After discarding your soiled gloves, open the sterile supplies, put on sterile gloves, and prepare the equipment. To obtain a sample for an aerobic culture, use normal saline or a skin disinfectant to clean the wound edges. Avoid getting the cleansing agent into the wound itself.
I'm going to use this Q-tip to take a sample of the wound to make sure the antibiotics are doing their job.
Next, slowly and gently insert the tip of the culturette swab into the wound. Apply pressure on the swab to produce tissue fluid. With the sample collected, return the swab to the culturette tube and cap it. Crush the inner ampule to release the culture medium and coat the tip of the swab. To obtain a sample for an anaerobic culture, clean the skin around the wound edges and let it dry. For a large wound, clean from the center to the outer edges.
All right, Asher, I'm going to have to take some liquid from your wound. Mom, can you hold his hand? Because this might be a little uncomfortable. You're going to feel some pressure when I put this inside your wound, okay? Try to hold your arm really
Then
good.
use a swabbing procedure similar to the one for an aerobic culture, or perform aspiration with a syringe, as shown here. Using a sterile, needleless syringe, insert its tip deeply into the wound. Aspirate 5 to 10 milliliters of wound exudate into the syringe. Then remove the syringe from the wound and attach an 18 or 20 gauge needle. After expelling all the air from the syringe, inject the collected wound exudate into the culture tube.
All right, Asher, we're almost done. I'm just going to dry up the edges of your wound here. Put some medicine on it and a clean bandage, and we'll get you out of here.
After either type of sample collection, use sterile gauze to dry the edges of the wound. Then put on new gloves. After administering any prescribed topical medication,
sorry, I know that hurts a little.
apply the dressing that's most appropriate for the child's wound.
All right, now we're going to put a clean bandage on it. Hold still for just a minute longer. Take this down. There you go.
Finally, label the sample with the child's name and send it with the requisition form to the laboratory. To obtain a sample for a throat culture, help the child into a comfortable position that allows easy access to the pharyngeal area. For an older child, have him sit upright in bed or in a chair.
Check for germs back there.
Will it hurt?
No, it shouldn't hurt at all, but you may feel like coughing or gagging.
For a young child, use the supine position. If a restraint is needed, apply a mummy restraint to an infant, or ask an assistant to help immobilize her. After putting on gloves, provide instructions for an older child.
Now, look up at the ceiling, stick out your tongue, and say, ah.
With your non-dominant hand, place a tongue depressor in the child's mouth so that it covers the anterior half of the tongue. Depress the tongue until you can see the pharyngeal area.
Ah.
With the opposite hand, quickly swab that area twice, avoiding the tongue, palate, and buccal mucosa.
That's it. You did very well, Colton. Now just relax, and I'll get you something for your sore throat.
Okay.
Without touching the tips of the swabs, place one in the culture medium. If you're doing a rapid strep test, place the second swab in the rapid strep reagent. After the time required, check the rapid strep test result. If it's negative, send the second sample swab for a culture. If it's positive, don't send it. After completing the procedure, teach the parents how to comfort the child and administer medications if ordered.
Colton may not feel like eating, but you can give him ice chips, water, juice to prevent him from getting dehydrated. And for the pain in his throat, he can gargle with warm salt water, or you can put warm or cold compresses on his neck.
Okay, which is better, warm or cold?
It depends on what he feels. He can tell you which one he likes best.
Okay.
If the doctor thinks it's strep throat, he will prescribe an antibiotic, and you should give it to Colton for the full time to prevent the infection from coming back.
Okay. Yeah, we wouldn't want that.